2021, we're celebrating our 60th anniversary of the hospital opening. To celebrate that, I wanted to share with you some history and then some of the things that have happened along the way. Starting with the concept of a new hospital. Back in 1953, Kokomo found itself in the position of having population growth to the point where one hospital wasn't sufficient to provide the care that was necessary here. The city council at that time in Indiana, there was a law that allowed counties to actually have a tax that would fund hospital building. It had to be approved by the voters. Our city council or county council put that on the ballot, and of a 3-to-1 vote, the local residents voted to put that tax in place to fund a new hospital to the tune of $1.8 million. At that point, then the council, they formed a committee to build the hospital. So they had 4 members from the county council that would be appointed to be on that group. And they stipulated that it would be 2 members from Kokomo and 2 members from the county. And they also allowed that one of those could be a woman. So that group was formed. They hired an administrator from New Albany, Indiana to come down, and those 5 people did all the planning to put this hospital in place. They did all the policy making, they worked on the building design, they did all the hiring, and they personally worked together with an architect to design and build this hospital. I happen to have a copy of the old minutes in my office, and some of it's interesting. For example, they paid a housekeeper 25 cents an hour, and they've also charged them 25 cents a day to do their laundry, so it was a different time. Once they had the plans complete, they recognized that the hospital was going to be about $2.5 million, so they were short. They only had the tax money of $1.8 million. So they formed a foundation, the Howard Community Foundation. It was formed back in 1954. Its purpose was to raise the additional money to close that gap and get the hospital built, which they did. And that foundation's still in effect today. In fact, in 2020, they actually gave us $438,000 worth of support, so still alive and well. After all that design work was done, they actually went to work on building the hospital. Ground was broken in 1959. They had some setbacks. They had a big fire on the site, and they had some problems with some of the supplies, but they eventually got it done, and the hospital opened on December 3rd, 1961. Some of the key milestones that have happened along the way. In 1968, we needed a larger ICU, so that was built out. In 1970, we participated in Kokomo's first ambulance service. In 1971, we opened the first comprehensive mental health service. In 1973, we opened Kokomo's first coronary care intensive care unit. In 1978, we opened Kokomo's first cardiac rehab. In 1981, we expanded our surgery. In 1988, we opened a new oncology center. And also in 1988, we opened Kokomo's first cardiac cath lab. In 2001, the Outpatient Indiana Surgery Center opened. In 2002, we opened our second cath lab. And in 2004, we opened an expanded behavioral health downtown in Kokomo. In 2007, we built and opened a new emergency department. And in 2012, a significant moment in our history, we joined Community Health Network. And they've been supporting us, we've been supporting them ever since. And we continue to reinvest in ourselves. We want to make sure we've got the cutting edge technology, we can provide as much service locally as we possibly can. Some of the things we've added to our arsenal, we have a robotic guided surgery system. We have a new linear accelerator, we have 3D mammography, and those kinds of things we're going to continue to reinvest in ourselves so we can offer those services to Kokomo and the surrounding communities. And we continue to recruit primary and specialty care physicians. We've done that over years, and I think it's been pretty successful, and including specialists as well. If you look at our orthopedic program, it's significantly expanded and is world-class. A common thread through all of this, though, has been the caregivers and the excellent care that we provide, and we continue to do that. I'd like for you to hear from our longest tenured member on our caregiver staff, and that's Kathy Boyle, who works in the emergency department.
My name's Kathy Boyle. I'm a registered nurse. Started here in December of 1976. Patient care has changed and evolved quite a bit from the time I first started. The biggest change probably going from paper charting to computer charting. And I think about IVs and patients' IVs, and before we had pumps, you had to have a formula where you would calculate how fast you wanted the IV to run. And you would have changed the rate of the IV, and you'd have to stand there with your watch, and you'd have to count how many drops were coming out versus the time on your watch. We've always had that idea that patients are first, and management, staff, support staff, clinical staff, support staff, always kept in the back of their mind that patients are the reason we're here, and we do whatever we can to promote that and be a good, caring environment and a safe environment for our patients.
So, after 60 years, we're still going strong. We're still pursuing our mission of keeping care local, high-level specialty care local, and expanding into the region. Thank you for all you do and just the support you've given us, making us the high-quality organizations that we are.